But today, and more moving into the future, the model is really different. The hospitals are today own the archive, and I believe the hospitals will own the archive and the enterprise viewer moving forward, and not just hospitals, but organizations that own multiple imaging centers, imaging center groups. The long RFP process is giving way to more of a try and buy mentality. Cloud-based, comprehensive medical image management and reading systems are making it possible for people to have a reading overlay to their existing PAC system so that they can try reading on a different system. And if they like it, turn their PACs off later. That's a very different model. And so I would say, rest in peace, RFP. It was a political process that was probably not ever scientifically validated. I think having expertise and consultative expertise when you're buying is still highly valuable. But I think the 600-page RFP and the highly political 2-year selection process is giving way to the try and buy mentality. All radiologists and teleradiologists are beginning to provide clinical workflow technology. So it's not just the telerad group that says I'm reading on what I read off of from midnight to 6 a.m., but it's happening 24 hours a day, where the rad group is saying we're going to have our own PAC system. We cover 5 hospitals. They have different owners, yet we need one system to read off of. Global billing is becoming more common, still not the rule, but we're seeing it grow, where the hospital is paying the radiology group a fee per RVU and global billing the patient. Built-in training and webinars have increasingly replaced on-site training. What does on-site training even mean when a radiologist is reading from home? Are trainers going to go to the radiologist's office or den or bedroom in order to train them? Not going to happen. So, and flying people around the country to try to catch, people one at a time in a 30-person group when 4 of them are on vacation this week, it never worked well, and it's going by the wayside. In addition to that, we're seeing greater and greater subspecialization, and that demands automatic exam assignment. More and more radiology groups are no longer reading off of an open work list, but in fact, radiologists are reading the exams that they've been assigned.